year or so. And he said this: every country, when it comes to mental health care, is a developing country. And I'd like to learn more about his reasons for why that is, but I can certainly understand it. I mean, the mental health care system in Canada and other developed countries, they all need work. And so anyway, the whole time I went through mental illness, my heart went out to people in developing countries or war-torn countries who have mental illness to go through as well, on top of all that. I went through mental illness here in Canada, in a sleepy part of Canada, very quiet, and I felt like I was living in a war zone. Just, in fact, someone saw me walking down the street one day at my worst in '94, and they said, Matthew looked like he was walking through a world of flying glass. And I went, yeah, that's the way it feels, just bombarded. And anyway, so it was 2017, and I found the first content that I'd stumbled upon on the internet about mental health in developing countries. It was a TED talk by Vikram Patel, and they found, well, some countries have only one psychiatrist per million people. There are over 270 million people in developing countries with no mental health care. And what's worse is that some people, they estimate hundreds of thousands of people in 60 countries are actually kept in chains with mental illness because they don't know how to deal with them.
Wow.
And it's inhumane. It's horrible. And Robin Williams' son, Zach Williams, is helping to promote this on his, well, with some other people, Allison Janney, the actress from the West Wing TV show, Tim Shriver, who created the Special Olympics. They have a hashtag Break the Chains platform, and I tell people about that on my website, minday.ca. And so anyway, I made this website to try to help. I thought, well, if I'm going to help anybody with mental illness, because over the years throughout my recovery, I thought, when I get back up on my feet again, when I'm ready to help other people who I help, and for years I thought, well, I'll focus on people here in Canada or wherever. But when I heard what some people have to go through, it's just horrible. So I thought, well, if I'm going to help anybody, I should help people who need it the most. People kept in chains with mental illness.
It's hard to believe, right? I mean, I know, it wasn't too long ago, but we didn't have the knowledge that we do now. But our biggest thing is probably getting the right kind of experts to assist someone, right? Because obviously, if you go to a social service agency, for instance, I'm not sure how long the waits are here where you are, but I know here in public sector, it sometimes can take 6 months. So if you're having an issue, that's a long time to go to wait for the support, right? So, but it's not one in a million. It may be that you need different kinds of supports, especially if you need psychiatric help to obviously get a proper diagnosis. So if you're waiting 6 to 8 months and you're dealing with all these symptoms, you can see how that can exacerbate the experience. Absolutely. So what kind of things are you doing with these organizations, and how are they helping to kind of deal with some of the causes that like, what parts of the world are they keeping people still in chains, and what can be done?
Yeah, so on the hashtag Break the Chains platform, they estimate 60 countries. There's a report written up on it, and that came out about a year or so ago. And I've found 6 nonprofits that are helping people on the ground get basic mental health care. This model of basic mental health care, it's been modeled after a physical healthcare model, a basic physical healthcare model, where there's no doctor, no hospital for hundreds of miles. How do you treat someone with a broken leg or this or that? And back in the 90s, I believe they modeled this after this, a basic mental health care model. How do you treat someone with depression or anxiety where there's no hospital, psychiatrist, medications? And the good news in all of this is this model is proven effective, it's low cost, and it's also scalable. And they're trying to figure out, the World Health Organization is trying to figure out the best way to roll it out to the masses. And until they do that, I don't know what kind of timelines they have. I mean, that's a big job. But until they do that, I found 6 nonprofits that I steer people towards on my website. And if anyone hears of any more, please tell